Now we'll study something about probable sign of pregnancy. Okay, so what is this probable sign? The pregnancy sign which nurse, as a midwife, and the gynecologist or the obstetrician, when they are going to observe something, then you call it as this probable sign of pregnancy. Okay, now in this first probable sign, we have something called as the pregnancy urinary test. Okay, so in this test, what happens is we during pregnancy, there will be an hormone, what you call it as an HCG hormone, okay, human chorionic gonadotrophin hormone, okay. So now this human chorionic gonadotrophin hormone, when it is present in the mother's urine, then we suspect pregnancy or we confirm pregnancy, okay. So this is the first probable sign of pregnancy, okay. And next is on palpation, okay. So when we are going to palpate the mother's uterus, we will be able to feel some parts inside the uterus where we can say that I am able to feel the part, and that is the fetal parts, okay. And now we will be able to outline the fetal parts, okay. So here the head is present, here the buttocks is present, and this is going to be the spine of the fetus, okay. So that we can feel it on palpation of the abdomen of the mother, okay. Next is the mother is going to have Braxtonix contraction, okay. So we know that contraction is something where the uterus is going to give pressure, where the uterus is going to squeeze like this, you call it as contraction, okay. Now when already I have discussed in something, when there is going to be a uterine contraction, the mother is going to have pain, okay. So but when you call it as Braxtonix contraction, it is going to be an painless uterine contraction, okay. So the Braxtonix contraction is going to be painless uterine contraction, but the mother will have tightness of the abdomen, okay. The mother can feel the tightness of the abdomen, that is what you call it as Braxtonix contraction, okay. So as a midwife, when we touch the abdomen, you will be able to feel this hardness, you will be able to feel the stiffness in the abdomen, which indicates the uterus is contracting, and it is called as Braxtonix contraction. That is why when we do the abdominal palpation, okay, so palpation, you know, we touch the abdomen, okay. So when we do this abdominal palpation as a midwife, we rub our hand like this, okay. So once when you rub your hands like this, your hands become warm, and then we touch the abdomen of the mother so that the contractions will not start. Okay, so this is one of our practical aspect what we have to do when we are going to do our abdominal palpation.